Assalamu alaikum. It's a psychiatry series where I will discuss about schizophrenia first. Starts with my intro. Okay, in here I will discuss briefly over schizophrenia. Hope you enjoy. Okay, now schizophrenia. Schizophrenia is a chronic illness caused by profound functional impairment. There are some positive symptoms, there are some negative symptoms, and there are some cognitive symptoms. So positive symptom, negative symptom, and they are mainly the positive and negative symptom. Via this positive and negative symptom we diagnose schizophrenia. There is auditory hallucination, there may be thought withdrawal, thought insertion, there may be delusion, hallucination, thought withdrawal, thought insertion, there may be disorganized speech, there may be bizarre behavior, and the diminished and then in negative symptoms, diminished functioning like flat, blunted affect, apathy, anhedonia, that means loss of interest, allogia, well, he cannot calculate, and social withdrawal. There are some cognitive problem, reduced ability to understand or make plans, diminished working memory, inattention. It is diagnosis. Diagnosis requires two or more than two of the following symptoms, including one or more than one of the symptoms from 1 to 3. Delusion, hallucination, auditory hallucination must. Disorganized speech from 1 to 3. One or more than one must be present for diagnosis to be fulfilled, and disorganized or catatonic behavior, and the negative symptoms. Symptoms onset 6 or more than 6 months prior to diagnosis and require 1 month of active symptoms over the past 6 months. These are the very high yield word. You need to remember that symptom onset more than 6 months prior to diagnosis and requires 1 or more than 1 month of the active symptoms on the past 6 months. Okay, it is associated with also dopaminergic activity, increased serotonergic activity, decreased dendritic branching, ventriculomegaly on imaging. Lifetime prevalence is 1.5% males. 1.5% males is more the females. Patients earlier in these males late teens to early 20s, then females late 20 to early 30. Increased risk of suicidal rate. Heavy cannabis use in adolescents is associated with increased incidence and worsened outcomes of the psychotic, mood, and anxiety disorder. Treatment is atypical antipsychotic risperidone are the first line. Atypical antipsychotic risperidone are the first line. Negative symptoms often persist after treatment and despite resolution of the positive symptoms. Okay, when we when we study schizophrenia, there are some problems like what is brief psychotic disorder, what is schizophrenia vomit disorder. For brief psychotic disorder, 111 should be remembered. In brief psychotic disorder, 111, like more than one positive symptoms lasting more than 1 day to 1 day and 1 month, usually stress related. So more than one positive symptoms, one or more than 1 day for more than 1 month, and schizophrenia from more than two or more than two positive symptoms lasting 1 to 6 months to 1 6. So schizophrenia form disorder, two or more than two symptoms lasting 1 to 6 months, lasting 1 to 6 months, so 2 1 6. Now schizoaffective disorder. In schizoaffective disorder, 2 or more than 2 weeks of psychotic symptom without a manic and or depressive episode. This is schizoaffective. Share the symptoms with both schizophrenia and the mood disorder to differentiate from mood disorder with a psychotic feature. Differentiate from a mood disorder with the psychotic feature. Schizoaffective disorder patients must have 2 or more than 2 weeks of psychotic symptom. Patient must have 2 or more than 2 weeks of psychotic symptom without a manic or depressive episode. And the delusional disorder, one delusion lasting more than 1 month. One or more than one delusion lasting more than 1 month, but without a mood disorder or a psychotic symptom. And the schizotypal disorder is a cluster A personality that follows cluster A personality that falls on the schizophrenia spectrum may include brief psychotic episodes of delusion and that are less frequent and severe in schizophrenia. Okay, now the usable inner circle part of the schizophrenia. So schizophrenia presents earlier in men. What risk what is the risk developing schizophrenia in monozygotic teens? 50% risk of having schizophrenia in monozygotic twins. So obstetric complication, hypoxia, hemorrhage, infection, preterm labor have identified an environmental risk factor for the later development of schizophrenia. So hypoxemia, hemorrhage, infection, preterm labor, an environmental risk factor for the development of schizophrenia. Also urban areas, birth in late winter, early spring, and paternal age advanced paternal age. Okay, 50% chances of having schizophrenia in monozygotic teens, 10% in first degree relatives, 40% if both parents are effective, and risk is 2% in general population. Family therapy is effective adjunct to antipsychotic medication is an effective adjunct to antipsychotic medication in patients with schizophrenia and has been shown to reduce the risk of relapse. There are some prognostic factor in schizophrenia. Good prognosis is female sex and predominantly positive symptom. So female sex and predominantly positive symptoms are for good prognosis, and male sex and predominantly negative symptoms is the thing of poor prognosis. Okay, clozapine is used is treatment resistant schizophrenia. Look here, clozapine is used in treatment resistant schizophrenia and schizophrenia associated with suicidality. We use clozapine. It can cause agranulocytosis, so CBC should be done for monitoring. Okay, schizophrenia, common medical condition with polygenic inheritance is a schizophrenia. Common medical condition with polygenic inheritance is schizophrenia. So in a nutshell, if I would like to discuss about the schizophrenia, what are the main things you need to what are the things you need to remember in case of schizophrenia?